All right, everybody. Welcome to JetroCast. As you can see, I have what's guaranteed to be one of your favorite guests that'll ever come on here. It's Betsy Keller. So many ties to Betsy. The primary one is that she raised a beautiful daughter who married my son. So we share a granddaughter together. It's the greatest thing ever.
It is the
And
greatest.
Betsy is like one of the most positive, happy people. And her story that she's going to tell today will probably highlight that to you. But Betsy, I'm going to tell you about a story about the starfish. Have you heard the starfish story before? About saving the starfish?
I have, but let's hear it again. I would love the retro version.
Well, I think it's important to say it because when we talk about, like, we're going to talk about breast cancer awareness. That's what the month is. I even have my pink shirt on for it. It's the best I could do. And there's a story that's the short version is an old man used to walk on the beach every day. And then one day after a storm, he noticed that a lot of starfish had been washed up onto the shore. And he noticed a young boy picking them up and throwing them back. And there were thousands of them. And he was throwing them back into the sea before the sun burnt them. And the old man asked the young man, "Why are you doing that? Because you're not going to be able to make a difference. There's so many starfish here to save." And the young man wisely says, "Because it makes a lot of difference to that one." And so it's
Yeah.
kind of a metaphor for anything we try and do in this world when it feels like this task is insurmountable. What we can do to change the world, you change it one starfish at a time. So
Yeah.
the purpose of the story, of that story in the context of today, is October is Breast Cancer Awareness Month. And I frankly have never not been that aware of it. But I know your story, and that we're going to talk about was probably the closest brush I've had with breast cancer. And I think it's important for people to understand it, and see if maybe we can even just touch one person, maybe he's going through it, or maybe help someone get early prevention, all these things. How have I done so
Yeah.
far, Betsy?
Fantastic. Impressive.
So I'm going to drop some facts on you, some breast cancer facts, and then we'll get into your story.
Great.
Breast cancer facts. See how I did that?
I love that.
Second slide. Ready? And I didn't know these things before today. Breast cancer accounts for about 30% of all new cancer cases in women each year in the United States.
Wow. I actually didn't know that either.
Breast cancer is the most common cancer diagnosed among women in the United States. It's the second leading cause of death from cancer among women. Only lung cancer kills more women each year. Not a happy slide.
Interesting fact. My mom died of lung cancer, so it's interesting.
Interesting. About 13%, 1 in 8 of U.S. women are going to develop invasive breast cancer in the course of their life. What do you think about that one? Is that number same? It seemed actually low to me. I thought more women get breast cancer.
Yeah, I've heard that statistic, and I just think it's interesting. If you put yourself in a room with, say, 20 women, like 2+ women are going to have breast cancer. I mean, I don't know. I think it's kind of high for just breast cancer, not just cancer. It's interesting.
Yeah. And apparently there's currently more than 4 million women with a history of breast cancer in the United States right now. So either those who are treating or who have been treated. And the last slide I'm going to drop of the knowledge is going to be 85% of breast cancers occur in women who have no family history of breast cancer. And the other slide that I saw that I didn't put on here is apparently in the 15% of people who do have a family history, if you have family history of breast cancer, your odds of getting breast cancer is like 50% higher than anybody else.
Yeah.
So Betsy, tell us your story. Take 2-3 minutes. Tell us your story, your breast cancer story.
So in January of 2022, I went to a regular checkup. I just had a checkup with my regular OB/GYN. I hadn't been in for a long time, like 5 years, and thought, I felt a little off and thought I should just go, check in, get my blood work done. And everything was okay. And he said, well, you probably need to go get a mammogram. And I had one maybe, I think when I turned 40. So a couple of years before. At this point, I would have been 46. And maybe I was 41 or something when I had my other mammogram. So I had done it one time before. And then, so I went in for a mammogram, and it actually took a long time. And now looking back, it's a little bit annoying, but it took a long time for them to get me in. They're like, oh, we have an opening in like 6 weeks. Like, okay, which is fine. Got my mammogram, I think in February. And then, and that came back. They called me and said, oh, we saw something. It's nothing to be worried about, but we just want you to come back in. We're going to do a different kind of mammogram where it's like a 3D one. It's just kind of like the more in-depth version. Come back. It's no big deal. No big deal. Don't worry. Don't stress. No big deal. Like, okay. And then I get in that room and they do it. And then they're like, we need to call the doctor. And don't stress. It doesn't mean anything. It doesn't mean anything. We just want the doctor to come in and look. And Then after that, I got a call that said, actually, we want to do a biopsy. And don't worry, it's not a big deal. They're good at trying to just not have you freak out. And I actually at no point did I really freak out. I actually was pretty calm, like, whatever, okay, whatever. The night before I had, no, let's see, so then I had the biopsy, which was interesting. I mean, it's like a little mini surgery. They treat it like that. They're rubbing you down with like the yellow, I don't know, what's that stuff that they rub you down before they cut your skin open, and
The
it was a
iodine? Is it
doctor.
iodine?
Iodine, yeah. And they had, they're like in scrubs with their hair back, and I'm in this room. And actually, the one thing I remember that was very sweet is I had to have my arms back over my head like this because they're going to be working in this area. So just to kind of keep it out of the way. And one of the nurses said, "Would you like me to hold your hand?" And that was like and I didn't, and if you'd asked me if I'd like that, I'd probably been like, I don't care, I'm fine, But in that moment, it was the kindest gesture. And I've never forgotten that. As I had to have my hands above my head, and she just put her hand in mine and just held onto my hand. And anyway, throughout this whole process, the humanity of the people working there have just been so touching to me, so kind. That was such a kind gesture. Anyway, so they did that biopsy and said, we'll get back to you. You'll know tomorrow. And that night, as I was laying in bed, the thought came to me, this really could be cancer. Like, what would you, because I really, truly hadn't, I don't know if I was just busy in my life. I really hadn't done a lot of worrying. And I thought it could be cancer. And I was like, oh, it's probably not. I'm a really optimistic person by genes, genetically. My dad is optimistic. I just, one of those people that sees the bright side. So I was like, it's probably not going to be cancer. But it came to me, and I'm glad that thought was planted in my head, because it was. So the next day, I actually had dropped my daughter off of running an errand, and I was in the Fred Meyer parking lot in Boise, and a thing popped up on my phone that said, your test results are back. So I was like, oh, clicked on it, and there it was. And I was like, oh man, malignant. Doesn't that mean cancer? So I'm like Googling, what does malignant mean? Which is so stupid, but I just wanted to make sure I wasn't getting it wrong. And I don't know how to read, medical test results. So it's in kind of their words that aren't really familiar to me. But sure enough, there it was. And I was like, oh, geez. So I called Clint and was like, well, it's cancer. It's like, really? So, but we didn't freak out too bad because we didn't know what that meant. And I knew even if it was cancer, I should say that the lump that they biopsied was not one I could see or feel. So it wasn't anything, I wasn't worried because I had seen this big lump. It was only found via mammogram and then via the ultrasound they did after that. So I never knew it was there. Saying that so that it's pretty small, which also gave me a little bit of comfort thinking, okay, even if it is cancer, it's not huge. But my mom did die of lung cancer. And so I had gone through cancer before in my lifetime of seeing someone going through cancer and treatment. So it was a little foreboding, kind of like, oh man, I don't want to do this. But that afternoon, or maybe it was the next day, one of the two, I got a phone call from my doctor, my OB, who I do have a good relationship with. He's delivered several of my babies. And he called and was like, Betsy, I wanted to be the one to tell you it did come back as cancerous, but I want you to know that if you're going to get cancer, this is the best cancer to get. She's like, oh, good.
That's all you want to hear, right? Yay.
I got the best cancer. Yeah. But it was also reassuring, like, hey, it's early, it's small. If you're going to get it, this is great. And that's why I am such a proponent of getting a mammogram. Like I said, I didn't know it was there. And early intervention is the best, because sometimes I joke with Clint and say, well, I didn't really have cancer. This is fake cancer. He's like, no, it's not. It was really cancer. But my treatments and my experience from outside, from if you just saw me, you wouldn't know that I did. And I still I still get a little emotional about it because it was hard. What I did, but it didn't look like me losing my hair and me, losing all kinds of weight. I wish that were my dilemma sometimes, but, so it maybe didn't look like that on the outside, but it was, and it was hard. So, that led into meeting with a couple of other doctors and a surgeon, and what they prescribed, the best thing for me to do to start immediately is to do a lumpectomy, meaning they're just going to go in, take out the cancer. So that was in June. So this took forever.
I
I
was
started
saying,
with
so
my mammogram.
initially you started in February, and it makes it, we're in
Yes.
June now.
Yeah,
Okay.
I was at my OBGYN in January. So from the time he told me to go get a mammogram, it was like 6 months by the time they got this out. So it was May 3rd was the day that I found out that it was cancer. and my surgery was June 14th. So I was kind of like, can we go any faster? But then looking at all the people in the world who have big cancer things and need surgery, it's okay that I was kind of on the bottom of the list. So I went in for what's called a lumpectomy, and they went in and they do a couple of really cool things, and I'm hoping that I remember all the details straight, but they had me go in a day early, and they inserted a magnet. They did like an ultrasound, were able to insert a magnet right where my tumor was, so that when the surgeon went to operate, she basically had like a little metal detector, and it's like, me, 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 me. I can go right exactly where it was. So it helps her guide through the surgery, which I thought was really cool. So they could go directly to the tumor and take it out. And then they also wanted to check my lymph nodes, because one thing with breast cancer is if you have lymph nodes all over your body, but especially some like in your armpit area. My tumor was on the top. It was like at 12 o'clock if my breast were a clock, right at the very top, which was kind of great because it made for easier recovery. But so my lymph nodes are just right in my armpit right here. So they wanted to just go check my lymph nodes, because if any cancer had left kind of from my breast tissue, it would have had to go through the lymph nodes first to get out anywhere in the body. So it's kind of like the lymph nodes are kind of like the stopping point, or I don't know, what would you call that, Jeff? Like the stopper or whatever. I mean, if anything was going to go through, it would have had to go through those lymph nodes first. So if they find cancer in your lymph nodes, it's an indication that maybe the cancer has spread. But if it's not in your lymph nodes, then it's great. So they did a lumpectomy, and then I can't remember what they call it when they take your lymph nodes out, but they did take 2 lymph nodes out, and they did find cancer in my sentinel node. The sentinel node is like the main, the boss node. And they ended up the surgeon thought it was one, but when it went to pathology, they're like, no, there's 2 different nodes here. Both of them had cancer in it, which was a little discouraging, like, ugh. But the pathologists claimed that the cancer hadn't gone out the other side. So the cancer was in the lymph node, like it was trying to get through, but hadn't gone out. So they felt really good about the fact that the cancer, that they were able to get it all out, that the margins, they had gone, kind of wide margins around the tumor to make sure it was gone. And then in my lymph node. And I should say that the kind of cancer I have is called invasive ductal carcinoma. So these are milk ducts in my breast that cancer had formed in, and it was invasive, meaning it had gone in the milk duct and then was kind of spreading its way out. But my cancer was 0.7 centimeters, so pretty small. And I don't think they ever told me a stage of cancer I had, because it was really that small, but it was a grade 1. And a grade means when you're looking at cancer, when the pathologists are looking at cancer cells, my cells still kind of resembled my healthy cells. By stage 2, they're looking a little different. By stage 3, they've totally gone rogue. So I was still a stage 1, so very early stages of breast cancer. And then they were able to tell, once they took the tumor out, they were able to test it through pathology and could tell that my particular kind of cancer was fed by hormones. It was called ERPR positive, meaning estrogen receptor, progesterone receptor positive. So the most important thing for me is they needed to take hormones out of my body, because the hormone creation is what was causing that cancer to feed. Are we good up to this point?
Yeah, we're good. Yeah, we're good. I'm just listening. Yeah.
Okay. So they did the lumpectomy, and my nurse had told me if there is cancer in your lymph nodes, there's a really high chance that you'll have to do chemo. So, but they have come out with this new test in the last decade or less. I'm thinking maybe 5 years. I can't remember what she told me, called an oncotype score, where they actually, I don't remember exactly what they do, but they do this oncotype testing that they did with, I'm thinking, the tissues that they took out. And I wish I could remember, and now I'm embarrassed that I can't remember the details, but I know that I had to wait a really long time for my oncotype score to come back. And when it did come back, it was right on the border. It was like a 19. And they said, usually if you're like at 18 or higher, they definitely want to do chemo. But when meeting with my oncologist, we decided because my cancer is actually a slow growing cancer and chemo works at killing fast growing cells, that it wasn't necessarily going to be beneficial in my case. So, but it was touch and go for about a week there. I was just waiting to hear if I was going to need to do chemo or not. And so that was a little bit like, because, chemo has such a bad rap, and it really is a hard thing to do. So, I ended up deciding with my doctor that wasn't necessarily going to be the most beneficial route for me. So instead, what I did is radiation, which a lot of people do both. So radiation is basically just exposing your body to radiation in a very small area over and over again repeatedly. I did it for 7.5 weeks. So I went into the cancer center every single weekday. They don't do it Saturday, Sunday, every weekday, Monday through Friday, for 7.5 weeks. It took me about 10 minutes. I would go in, I would take my shirt off, put a gown on, lay under a machine that kind of feels like if you've ever had an x-ray, just laying on a table, and they line up the machine to be in the exact spot. Oh, I will say I did have to get some tattoos. So I am tatted, which is,
Oh, look
kind
at
of,
you, street cred Betsy.
I know, I know. So
You
I
got
do
more
have,
tattoos than me then. Keep going.
right. I have little tiny purple dots, one in between in my like cleavage area and one on either side, and it would line me up perfectly with the, I won't use the word lasers, but they had ways to kind of make sure they were hitting the exact same spot every time with radiation. So I did get little tiny purple dots, and every once in a while I see it. I'm like, oh, I forgot it was there. They're tiny. I am a freckled person, and they're smaller than my freckles, so it was no big deal. But it was funny to be like, well, I'm going to get my tattoos today. So I line up in the same spot every time. So it would, and then it just basically burns you and burns your tissue and makes it so that nothing else wants to ever grow there again. It's kind of like laying out in the sun on a summer day, and like 5 hours later you go home and you're like, oh man, I'm so red. But while you're out there, it just feels good or fine or whatever. So it took about maybe 2 or 3 weeks before any burns really showed up, because we're talking, they're putting that radiation on my skin for maybe like 3 minutes. And then I go home. Like, it was really short. And just watching, if you are interested, if anyone listening is interested, on my Instagram account, I cataloged or that's not the right word. You're going to have to edit that.
Documented.
I documented this pretty
Yeah.
well, and they even allowed me to go in and show what the radiation table looks like and how the machine moves around the radiation table. It was so fascinating to me. It was something you hear people getting radiation, but I don't really ever know, what does that look like? What does that mean? I don't even know what that means. And a lot of people say, oh, my friend's going to radiation. What can I do to help her? And I'm like, radiation isn't really that big of a deal. It's a big deal. It makes you tired, but it's not like chemo where it wipes you out. Because you go every single day. I mean, every day for 7.5 weeks I was there. And it just takes a couple of minutes. And then I went and ran my errands or did whatever I needed to do. It doesn't really slow you down. But back to the burning, yes, it does burn your skin. And I had radiation burns. My first burns showed up actually on my back, and I didn't know what it was. And I kept itching it. I was like, oh, my back feels so dry and itchy. And Clint looked at it, and I had scratched it to the point that it was bleeding because the skin was so fresh, which I didn't know. I hadn't even considered that it would burn all the way through me. I don't know why, but I just hadn't. Clint's like, I think that's a radiation burn. And when I went and looked at my back, it was like a perfect triangle, exactly like right here where they would have burned me, but on my back, which I was like, whoa, it burned all the way through me. So, and then it started showing up on the front. So it just looked like a really bad sunburn. Mine didn't get blistery. I saw some horrible pictures when I Googled what radiation burns look like. But they sent me, talking about great care too. I mean, when I went in, they're like, this is the cream. They're handing me buckets of cream. This is the cream. This is the lotion. This is the salve. Like, these are the things you want to rub. They said, don't go buy anything. If you need anything, we'll give it to you. These are the things we recommend. And so I was just really careful at kind of keeping my skin moisturized. And so anyway, that was what radiation looked and felt like. Other than making me tired and just needing a nap some days, it really didn't set me back that far. So that's why I say I have fake cancer, because I'm like, well, I never really suffered. But in conjunction with the radiation, I also am doing what they call I wrote it down to make sure I said endocrine therapy, which means medication to just kind of to make things in my body look and feel different. So I had to go on ovarian suppression, meaning they're going to shut my ovaries down. And they do that through Lupron, which is a drug they use for breast cancer and prostate cancer. And it's actually a drug they use like for IVF. It messes with your ovaries. So basically they're trying to shut my ovaries down so they don't create any estrogen, so that no estrogen can be in my body, so that I can't feed the cancer. So that was a monthly injection up until the beginning of this summer, and they switched it to quarterly. So I go in 4 times a year, get an injection just at the top of my rear end and the fatty part of my lower back. And I haven't had really too many side effects with that. The side effects of that are hot flashes, which I actually have had horribly. But other than that, not bad. And some weight gain, which is no fun. And then along with that is an oral medication I take every day called tamoxifen. And tamoxifen also just makes it so that my hormones won't keep producing. So basically put me into premature menopause, which I wasn't too far off. I'm 47, so it was going to be coming anyway. But after about 4 months, I quit having periods, and hot flashes have been pretty brutal at night and during the day. I'm just a sweatier person than I was before, which is really annoying. But other than that, it really hasn't affected my life terribly. Other than just some minor inconveniences of that, but it was scary, and it's always humbling to go through something like that. I don't really like going to the cancer center. I usually cry on the way home, even if it's been a good appointment. There's just something really humbling about being there. I am almost always the youngest and healthiest one in the waiting room, and just seeing what people are going through it's just really humbling. How hard we have to fight for our lives sometimes. And I feel very blessed that I feel like I didn't have to put up that big of a fight because of early intervention. So anyway, ask some questions, I guess.
Okay, so you are at this point clear scans.
Yeah.
What does that look
Yeah.
like?
So they had me go back in for another mammogram, probably, I think this spring. So maybe it had been probably a year later. And when I went in, I just went in for, I thought it was a regular mammogram. And they're like, oh, we're so sorry. We didn't realize that you are breast cancer. Like you had just gone through this. You actually can't do a regular mammogram. You have to come back next week and do this really in-depth one. I was like, oh, of course. So when I went back in, she said, we do this special one, upstairs. You have to go upstairs to the special mammogram machine. She said, we do this one, your first one after breast cancer. We make sure we do it on a day when there is a radiologist here to immediately read your results so that you know immediately instead of making you wait, which I thought was also very kind. So we did that, and she came walking in the room and said, your scans are clean. There's no sign of cancer. And I burst into tears. I wasn't planning on being emotional. I hadn't really thought about it, but hearing those words was like, I didn't know I'd been holding my breath for a year, but and again, I hadn't really even been anxious about it, but hearing her, she just hugged me, and I thought, oh, just the goodness of people. So kind, and so much compassion coming from the nurses and the people at the cancer center. That's all I felt, is just compassion, really kind. So.
Yeah, one of the banners I made as a follow-up is this one here. What tips would you have for the mental and emotional health prior to diagnosis? Like when you're like you talked about that period of time when you weren't sure, but it sounds to me like you weren't really processing or
I don't think I was. Yeah, I think that's probably me and my positive outlook. I think I probably put a wall up. I'm not saying I'm healthier. I'm saying I probably just cope with it weird, that I put a wall up. I'm like, oh, well, I'll worry about that when it gets there, which probably isn't the right thing to do. And on my platform of my Instagram account, I've been able to connect with a lot of people who are going through the same thing I am. And it really is interesting to read their stories, and a lot of people saying, I'm so terrified. I'm so terrified. And I didn't really have that experience of being terrified, but it's real, and you do get scared, and you don't know what the future looks like. So I think I was grateful and appreciative of having a husband who's really, really supportive, and kids who are really supportive. We had the chance to kind of gather everyone around and say, this is what's happening. Things are going to look and feel a little bit different. While we don't know what it means. I'm a religious person, so I went to prayer, and I went to the temple, where it's a place that I find peace for me. So those things work for me. And just having a supportive family, I think, is great. If you have a friend who is going through this and you're not sure how to help them, I just think reaching out and checking on them. I appreciated that so much, of friends just saying, I just heard about this. I want you to know I'm thinking of you. That was just so kind and so helpful.
Well, it's nice to know that's what people want to hear, because I don't know what to say.
Right.
I don't like to talk to people on the phone anyway. Like doing these podcasts is like pushing me outside of my introvert level already. And then I don't know what to say.
Text is great.
Text. Yeah, text.
Yeah.
I guess just let people know you're thinking about them, right? Just thinking about you.
When you get a text from anyone, if you're going through something like, hey, and you're like, oh, wow, you're thinking about me. That's cool. I really appreciate that. Everyone's different, but I appreciated that. Just people saying, hey, thinking about you. And a lot of people brought things over, which is really kind. But I didn't need anything. I was getting up and going to the store every day. Like, yeah, I don't need anything, but just knowing people were thinking about me was so kind.
And if you listen, everybody calls it something different, but there's definitely energies in the universe. And if you allow yourself to be in quiet moments in life, the one way people call it, like, spirit from God, or people call it energy, it doesn't matter. If you listen, there's someone who needs to hear from you if you just take the moment to receive that. So that's good. Now, for people who, I guess it's really interesting that you didn't, it doesn't surprise me that you weren't losing sleep over it because of your personality. But for the people who do, I guess you have to process that, but at the same time, it doesn't worrying about things doesn't help you. It's just basically you're taking your future fear and bringing it to the present, and you're allowing it to impact your present when we don't even know what tomorrow brings. So
Again, a word I keep coming back to is compassion at the hospital or at the cancer center. I mean, the doctors were so, every doctor I worked with and every nurse I worked with was just like gushing compassion. And so going in, they kind of ease your worries a little bit. They're going. I mean, I remember the first time I met with the radiology oncologist, who was the guy who scheduled, figured out where to radiate me and everything. Like, he grabbed my hand and put my hand in his and says, "You are going to be just fine. We are going to take fantastic care of you, and you're going to be great." I mean, just so much confidence, and like, I know what I'm doing. You trust me, and you're going to be okay. And that he bothered. And I mean, this was back when we were still all wearing masks in hospitals in Boise in 2001, not 2001, 2021. We all were still in masks. And so it was, I didn't like that. I was never a huge fan of masks because I feel like it takes away that personal connection. So for him to bother to grab my hand and hold my hand and look me in the eye and say that, it was really impactful to me. I appreciated that so much. So I think they do what they can to try to take the worry away. I mean, I'm speaking from someone who didn't have a really massive cancer diagnosis. I know there's other people out there that don't have the same news that I do. And I think if I'd been in that situation, I would have been a lot more worried. But because mine was early and slow growing, it was a little easier to be positive.
probably a tip would be, and I've not been through this, but I've been through it. I've had loved ones have cancer. I think you just have to talk about it. Like, you can't
Yeah. Oh,
bottle it
yeah.
up.
Yep. They offer, it's amazing the things that they offer, but they do. They offer counseling. They have religious people from various religions on call if you want to talk there. Like, if you want to talk to someone that's a Catholic priest, or you want to talk to someone that, I don't know, all the different denominations they have. That, and they have non-denominational, just counselors, therapists. They have something I took advantage of a lot when I first started getting really bad hot flashes. They have acupuncture that they offered at a very, very low cost. It was like $20. And usually, out in the world, it's over $100 for acupuncture to help relax you. And they have masseuse, they have physical therapists. I mean, they just, at least I'm speaking about St. Luke's Cancer Center in Boise, Idaho. So everywhere is a little bit different, but I was very impressed with not just the support they offered, but they backed it up with, we can give you this. They have nutritionists you can work with. I mean, all kinds of different people to help make your journey as smooth as possible.
Cool. So, what tips would you give for early detection? Sounds like this one kind of just was started with a routine visit. I
Yeah.
guess routine visits would be the way to
Yeah,
start, right?
get your mammogram. Like, I don't know why it has a bad rap because it's uncomfortable. I'm a person who's never had a colonoscopy, which I know I need to do that, but I don't think it's
I
even.
need
I
to
mean,
do one
it's not
too.
like
Should we do like
yeah,
do it for the
go live.
Instagram?
Maybe we should. Yeah, we're the same age, right? No, you're maybe a couple
Yeah.
years older than
No,
me.
I'm
Yeah,
49, so whatever you are.
yeah. You, Rochelle, and I were born the same month, so we're
Okay.
the same age, so we're close. But I think that just staying on top of it. Once you turn 40, go get a mammogram. And people are like, "Oh, mammogram." It's like, it's uncomfortable, but it's not uncomfortable for very long. It's not that big of a deal. If they could have cuter gowns, it would help, but they don't. And so you just roll through it. But yeah, just staying on, just getting a mammogram. Like I said, mine, I would have never felt. People say, "Oh, you can do self checking and feeling for lumps or whatever." Mine was too small. I would have never felt it. The doctors couldn't feel it. Even when I went to my surgeon for the first time, she was trying, and she's like, "Oh, I can't feel it. So we're going to have to go find it." That's why they put the little magnet thing in there to find it, because it's buried down in there.
So for you, it's the mammogram. For others, I mean,
Yep.
I'm assuming the self checks can also be another tool.
Yeah.
There's
I think
other
it's,
blood
yeah.
tests. Other blood
You
tests.
know what? I don't know, because I had a full panel of blood work done with my doctor in January, and everything came back looking good, whatever that means. Like, I don't think they have like a cancer line that's like, oh, we checked for cancer. I don't know. I don't know, but it didn't show up in any of the blood work with the doctor I was working with. That didn't come up. So I don't know enough about medical testing to say.
Did you feel the need to get a second opinion, or would
I
you recommend
didn't.
that?
I don't. I think that if you're not sure, I don't think that's a bad idea. I felt pretty confident in my doctors and in the people I was working with, and because it was a nice cancer diagnosis.
Yeah,
So I
you
did.
like the news, so like I'm not gonna
Yeah,
find worse news.
yeah, exactly. No thanks. I'll go with this. But and I, at least for me, I mean, I was working with three doctors all under the same umbrella, but I'm working with the radiologist, radiology oncologist who does the radiation. I was working with a medical oncologist who's the one that prescribes any medications like the Lupron and the tamoxifen that I take. And I was working with a surgeon. And one other thing they did that was really helpful is St. Luke's assigned me what they called a nurse navigator, which was a nurse who would call me weekly and walk me through all of this and explain every last thing to me, which was so helpful because you do get this diagnosis thrown on you and it's like, what am I supposed to do? And she set up all my appointments, or at least said, okay, here's the name of the lady at this office. She's going to call you tomorrow to set up your appointment. And, she had kind of went ahead and paved the way for me for everything and explained everything. And if I ever, she gave me her cell number. If you don't understand what someone says to you, or if you don't understand this, you call me, I will walk you through it. So that was also really, really
It
helpful.
was shocking to me that you found out that it was malignant based upon something you got on your phone. So you pull up the phone and
Yeah.
no one's giving you news you see malignant. That how did they allow those results to go to you first without
That's
someone
what's
telling you?
so I think what's so cool about patient rights right now. I mean, I always get, especially now that I'm doing this, but I get my results back at the same time the doctor does. I mean, once the results are published, they're published right into my chart. So for me, I have an app called My Chart, and I have access to everything the hospital has on me. After every single doctor's appointment, I can go in and look at the doctor's notes. I like to go back and like, how much did I weigh 6 months ago? I'll go look at my, when I was in the office, I have access to everything that's in my medical chart is right there. So yeah, it was really interesting that I saw and was like, malignant. Wait a minute. Uh, yeah, because then my doctor called me, and that was probably like at like 4:30 or 5 o'clock on a weekday. So my doctor called me the next morning when the hospital called him and said, hey, one of your patients has cancer. You need to make the initial phone call. I assume that's what happens. So he called me and told me about the nurse navigator that was going to call me. So he called me and was like, I don't know if you know. And I'm like, well, yeah, I saw. So it's interesting this day and age. You have the rights to have access to all your stuff. So when I get a new test result, it pops up as a notification on my phone. A new test result is in. So I can see my chart as soon as the doctor does too, which is cool.
Yeah, I know the handle I have up says tips for handling the news, but there's probably a million ways to handle it. I think most of the time you end up going in on a visit. Is it in person? I don't know.
Yeah,
I don't know. My
mine
dad
was
had
all
brain
over.
cancer. I can tell you the guy who reads the scans called and like said, you need to go see an oncologist right away. I'm like, bro, you're not supposed, I don't think you're supposed to just tell us that. Just tell us to go. I would rather have gotten the news in a doctor's office. I can tell you that with someone
Right.
who could reassure
Sitting
me
at,
than,
yeah,
yeah.
yeah.
Well, I think the tips for the news, I mean, you give me your perspective. Mine would be, and I haven't had cancer, obviously, but I've had people who my father died within 6 weeks of being diagnosed. And you have to go into a very tunnel vision mode as to just what's the next step. You can't get spun out of control. And actually a friend of mine right now, he's young. I think he's around 40s. His wife was just diagnosed with colon cancer and they're very early stages. They haven't done surgery yet. And he's just like, we just have to go the next step. The next step is surgery. We can't go into all the bad
Right.
things.
Yeah, you can't. And like you said before, like the what ifs, you can spend your whole life worrying about, but what if, but you don't know. You don't know. You just have to do one tiny step at a time to the next thing. And I felt frustrated that it was spread out. I'm like, this is May 3rd, and you're telling me I can't have surgery till the middle of June, but just be patient. They know. They do this every day. They're working with people every day. Trust the doctors, and I know a lot of people out there that don't trust doctors. In my case, I did. I don't know any different. I could have chosen like, oh, it's small. I don't want to worry about it, but I wanted to worry about it, take care of it.
I can't blame you. What we talked about your treatment. What I know you didn't do chemo, but you've been through quite of a process. I mean, you're downplaying it. I know you think you didn't have real
Yeah,
cancer, but You're just
I know.
you're
Well, I'll
being
tell you one
humble about it. You
interesting
did.
thing. Yeah, yeah. One other thing I didn't bring up that is that, and this is just showing that I'm kind of a ding dong. This after my radiation ended, I felt okay still, and I went to. They had me meet with a physical therapist and do some exercises, learn some exercises. That was about a year ago. I finished. I remember being at Kate's house, Kate and Max's house a year ago, and like doing my exercises over the door, and so I didn't want to lose my range of motion. And then it was the holidays, and then it was everything else, and um probably a couple of months ago, maybe into the beginning of this year, suddenly I was like, my arm is so stiff, and I was having stiffness and pain all the way down the side of my body to my waist, like all the muscles all the way down. And I talked to my brother, who's a physical therapist, and I was like, why am I so stiff? And he's like, because the radiation trashed your muscles. I was like, what? He's like, yeah, the radiation trashed your muscles. Like you're never gonna get good muscle strength back there. And I'm like, what? How? And he's like, that didn't they have you meet with a physical therapist? I'm like, yeah, but I thought I don't know what I thought. I don't know. I thought I could just like bring them back. He's like, no, they're gone. So that is something that I have to worry about and think about a lot. Right now, I'm going to a place called Stretch Lab where they stretch me every week. They do tons of massaging and stretching and just trying to keep these muscles limber because I do not want to lose the range of motion in my arm. And everyone gets radiated in different places, but that's mine was up here. And so it affects my shoulder and it affects all the way down my side. So I think just being aware of, I don't think that it was really explained to me the aftermath. Like it's going to kill the cancer. And then you're like, great, kill the cancer, whatever it takes, you know? So, I didn't really know that it was going to do a number on my muscles and not just this exact spot, but the muscles are all tied together. So if these muscles are weak, then these muscles, you know. So that is something that is continuing to play out for me that I wish that I had either thought through or been explained a little better. And they probably did, and I just didn't listen because I was so worried about the immediate. Anyway, so that's just something I'm aware of, and I just have to be careful, and I have to do massage and stretching and those kinds of things just to make sure I don't want to lose that range of motion, like I said. So, tips for treatment. I think everybody's body might respond a little differently, right? Just depending on who you are, your age, your body shape and size, and all of those things. The people, like I mentioned earlier, people are like, what should I do for my friend who's going through radiation? And I'm like, well, they might need a nap, but it wasn't like I wasn't able to come home and make dinner for my family. I felt fine. My skin just had gotten burned. It wasn't that big of a deal. But again, just letting yourself take that nap, at least for me, it was like, yeah, you're kind of going through something. So take a nap, like, or schedule that in if you need to. Like, you know what? I have radiation in the morning. I'm not going to schedule something out for the afternoon because I'm going to be tired and I'm going to want to lay down. So giving yourself, I think people like me and probably like your wife are the kind of people that are just like, nope, we're just going to keep going. I know I can do all the things and roll with it, but allowing yourself to kind of sit back and go, no, this is hard. And my body needs a second to relax through this. Even though I didn't do chemo, and chemo, makes you so sick and you lose your hair and it's just much more visible to everyone that you're sick. But radiation takes a toll too. So just trying to give yourself permission to really relax and not be so stressed, you know, not worry about not being able to get all the things done because you can't.
Yeah, I mean, listen to your body.
Yep.
Recovery, it
Yep.
knows. Your body knows, and you have to focus on recovery. It seems like
Yep.
mental and physical would be
Yeah.
super important to do. Um, so, question. This question presumes that there's that if this was a legal question, someone would object to it because I haven't asked you the question yet, but I'm going to assume that having breast cancer has changed you in some way.
Yeah.
And let me know, like, just how it's been different for you. It could be physically or just emotionally, the way you view the world, the way you view your life, whatever.
Yeah, I think anytime you're faced, like I said, I didn't stress too much about it, but you do stare death in the face a little bit. And going in and out of that cancer center is really humbling. And you recognize what you have and just trying to live each day to be your best and trying to make sure that you have I'll say me, not you, me making sure that my priorities are where I want them to be instead of worrying about things that don't matter or letting relationships go or just having a really tunnel vision about something, trying to go, it actually doesn't matter. So I think it gave me a little better life perspective in that way. Not huge, but Yeah, definitely. I see things a little different. And I think it also gave me a lot of empathy for people who are going through hard things. Um, Again, people go through harder things than what I did, but every time you do something hard, you just gain a little bit of empathy for someone who's going through something hard. Um, and it just, as you know, with your dad passing, now when a friend of yours has a parent who passes away, you can feel that, like I know how that feels, and that is hard and that hurts. And so for people that I've known that have since had a cancer diagnosis, or people that I've been able to connect with via Instagram, I'm able to just give words of encouragement to. I have a lot of people message me and say, my friend was just diagnosed. What did you like? What should I do? And just being able to give tips there, which is what we talked about earlier. Just be their friend, reach out to them. Don't be weird. Don't be standoffish. Be there for them. But you also don't have to drop your whole life to take care of them, because they want to keep living their life as normal as possible too. So, but I would say just maybe a broader perspective on birdies.
And I really respect it as you went through it. You were pretty real about it. And because of that, you were able to connect with people mostly via your Instagram. And we'll give you a plug here in a second.
Okay, thanks.
So you can get at least 100 more followers
That's
from
right.
this.
That's right.
And you were, but really, I mean, people just the good side of social media is this: people can
Yeah.
form a community. People don't know each other, and so I really respect that you were able to share that and help people out. Appreciate you coming today to talk about it too.
What's interesting, Jeff, I would say I didn't know that I needed my Instagram when I had breast cancer, but that was one of those places where I was really raw, and I would say it how it is until when I was diagnosed, my sister-in-law, who has a large following on Instagram, was like, you need to talk about this. You need to be the face of this, of early intervention. Cause I was like, I don't know if I want to go there. Maybe I just need to just not talk about this on my Instagram, because that's not really what my Instagram account is about. I'm not a medical professional. And she's like, no, you need to talk about it. And I was so grateful for that advice, because I am who I am and this is what I was going through. So I did talk about it and threw it out there. And the support that I felt from total strangers of, I am praying for you, or I am thinking of you today. How are you? These are people I do not know. If I walk past them in public, I would not know who they are, because I only see a picture that's, a pinpoint. Yeah, exactly. Or it's a picture of a flower. Like, I don't know who Lucy is, I don't know. But people that were reaching out and caring, and I was like, wow, if I started this account for no other reason, even though it's all me wanting to talk, just, it's because I felt so loved and so supported by a whole community of strangers during a time that was hard for me. So it was such a gift. Like you said, the best of the internet kind of comes out. So that was awesome.
What would you want people to know about breast cancer? Like, if you were just give your final, if we were going to cut this
Yeah.
into like a 1 minute
Yeah.
TikTok.
I think that it's not as scary as you think it is. I think that would be my other thing, is just because you have a breast cancer diagnosis, for most women, especially the statistics are 1 in 8 women will get it. Not one, we're not all dying right away from breast cancer. So when you do get a breast cancer diagnosis, it's not a death sentence, and that the care is so good, and the care is compassionate, that it's anyway, that's not a death sentence, I guess, is what I would want people to know, that it's treatable, it's curable. Maybe not curable, but it's very treatable, and you can live a very full life after having a breast cancer diagnosis.
So there's hope.
Yeah,
There's
really, a
hope.
lot of hope. Yeah.
And if it doesn't work out, we can't really control that either. We just do the best we
Yeah.
can, right?
But don't worry about it. Right. Yeah. The best you can.
When I get in this frame of mind, this is what happens to me. Every single thing, like, I'll just spin it down to, yeah, nothing really matters because we're going to die. And then I'm like, well, you can't really live your life that way. That's not really the way to do it.
Yeah.
You got
Well,
to
you might
find
as
the
well live
balance.
happy. If we're all going to die anyway, live happy with the people you love.
That's true. So tell us, take a couple minutes to talk about what you do. You have your Instagram, that's Betsy's Best Bets. I was going to
Yeah.
steal it and do Bestie's Bets, but I probably would have gotten
Oh,
sued for trademark
I
infraction.
had a lot of people message me and say, you could say Betsy's best breast. Or like when
Oh,
I started having breast cancer, people were coming up with all kinds of ideas. Betsy's best breast. I don't know. Anyway, lots of
Betsy's
funny.
Breast Bets. Yeah.
Yes, breast bets, best breast. I don't know. Anyway, we could have done a lot of play for that. So yes, I have an Instagram account that's my hobby, and it's just a really fun thing for me to do. And I just share my best bets. So like, I think my bio says something like, reviews, recipes, recommendations, reviews, recipes in real life from a mom of 6. So just, I kind of talk about a little bit of everything. They say to niche down to get more followers, but I'm like, I can't niche down. I like too many things.
You've gone kind of virus.
I did have one video that I recorded on a whim, posted on a whim with no effort whatsoever, that did have a little bit of a day in the sun, and so I did go a little virus, and it's kind of fun.
What was the video?
It's the video of how to stop a bloody nose by rubbing powdered jello on the top of your lip right here.
Wait, you can stop a bloody nose by putting, I don't remember this one. I remember the little thing you shove up your nose that stops bleeding.
No, 3 million views, Jeff.
Max has an unstoppable bloody nose. Our friend told us to rub jello underneath his front lip. For some reason it worked. Let's see if it works right now.
Yeah, not good. Okay.
Right. Just like doing drugs.
Yep.
Like on TV. One more time.
Okay, gross.
That's a self-start.
It's been 2 minutes.
Not even 2 minutes.
Oh my gosh. It's completely gone.
Yep.
That's bad.
That's bad.
If you have a bloody nose, lick your finger, stick it in the jello powder, any flavor. It can be Walmart brand jello. If you just want gel, it can be plain gelatin. You rub it on your gums, under your top lip, on your teeth. Your nose stops bleeding within 10, 15 seconds. Coagulates the blood. Yeah, we demoed it.
Oh, I'm going to find
And
that
if
video.
you ever want to know the million, I think there's like almost 2,000, maybe more, maybe less, I can't remember, 2,000 different comments on that video alone, most of which are telling me other ways of stopping a bloody nose. So if you are ever at a loss for how to stop a bloody nose, that is just a treasure trove of bizarro ways, stomping your foot, putting cold scissors on your back, like all kinds of bizarro ways that people stop bloody noses. So if you're interested, there it is.
Oh, I might do a podcast on it. We might have to find a lot of leaders and test it.
Well, we have nose bleeding family. I am the only person that lives in this house that doesn't get nosebleeds routinely. I don't know why. Clint has bad nasal passages and passes it down to all the kids. And that has been the only thing. But it stops them right away. We carried in bags to basketball tournaments. It was a family friend. We were at a basketball. Their son was on the basketball team with our son. And she said, well, don't you know, you just do jello. And her husband was the assistant coach of Max's basketball team. So he brought a box of jello to the next game. And sure enough, Max got elbowed, got a bloody nose, rubbed jello, and it stopped like that. And he went back in the game. So Jack had to miss a whole quarter, like almost a half of a basketball game last year because he had a bloody nose in the bathroom and couldn't get it to stop. So from then on, we've just carry a little baggie of cherry jello with us everywhere, and in their basketball bags. You need to throw it in Joe's soccer bag. If any gets a bloody nose, you just rub it up there, and the bloody nose stops. They're back in the game in no time. It's crazy. Best bet.
Wow, that's amazing. I knew jello was like a staple in Utah and Idaho meals and funerals, but this is a new.
I know.
Well, Betsy, thank you so much for coming on. I'm sure we'll have you come on again and talk about.
I hope it's been helpful.
Of course it has. Of course it has. And we appreciate everybody tuning in as we go virus and take the world over with our knowledge.
That's right. I love it.